also he's partnering with Amisurge to do this. He's the one who's sponsored it.
Yes. Where we are sleeping and all of that. So whatever song you do here, you do everything.
And afterward there is a barbecue.
That's right, because if you operate one place in one put car,
he's the PRO. And he's the deputy CMD, he's the pediatric surgeon consultant, Dr. Jan. The only pediatric consultant.
I am the servant. That's what he's telling me.
The only pediatric, and then he's a PRO. And we are very happy with the hospitality you've given us, and the reception and the support. Actually, without it, we will not be able to do what we are doing. So we are very grateful. Yeah, so we look for people like you who would always support us when we go out, because we have only one sole intention is to make sure the people around that we meet have safe surgery. We help to restore their health so that they go back home, continue what they are doing, be adult, be a child. And when we are here, any cesarean section that comes, a pregnant woman, we do the surgery. Anything surgical we do. And if there is a major case that we can't do here because it's like anesthesia, we send them to Banjul, and then when we do them, we make sure we do them. So that's important of this. And then it's known if you operate people in their own locality, the outcome is better than if they travel to other places, foreign place that, and then the outcome is different. The outcome is far better. And then now for economic advantage is good because they are home. They are good, they may not have any place to lodge, all the difficulties, all the stress, all the anxiety. But when you do here, this is their own place. So we are very happy we're able to do this, and then we are also grateful that we're able to support us to do this. Thank you.
Very appreciated Chloe Brand and your team. I came to few months ago, so in that they also expressed the intention of doing more here. So as a representative of people, I said I think this is what I'm looking at the industrial situation of the hospital and also cases that are either referred to Banjul or Lemman Clinic. Looking at the catchment area, it's about a 50,000 population. And the health and the needs and so on. Health is a great thing. So I believe Amisurge exemplary leading the field of healthcare system. Son wanted to live in Farafenye and Bansa. So this was why I was also amazed, to partner you people. And I think it's Gambian rule. So your sacrifice towards healthcare delivery is seen. So I believe I could say, periodically we stay here. We are all in this together, and I believe that this is what you from Gambia will do for the society. Caring one. I know sometimes some of these surgical operations, one could be 50,000 or 40,000 or plus. But looking at the commercial aspect, but the people are doing free of charge. I think this is a noble cause that I as a representative also, will shout the name of your organization. And also, I would also talk to others so that we can also lend a support, to make sure healthcare is a thing of the past. So I believe so. I'm very happy, and I think I could say, whatever you're facing in Bwam, just be rest assured that we are in this together. And definitely, I'm very amazed. The team that you are, also sacrificing your time and energy. You could have rested. I came with some doctors, Dr. Michael and others, who was working yesterday. So they came because of behind. So definitely, I'm very pleased. And I wish Allah subhanahu wa ta'ala to guide and protect all of you in the field that you want to endeavor. Whatever specialization you are adding for, Allah subhanahu wa ta'ala make it happen. I'm really amazed.
And then not to cut you short, this amazingly, this team is, I can say 99.9% comprised of Gambians. Gambian youth, as you said, Gambian nurses, who are getting some other supporting staff, doctors, anesthetists, all came together, to take this venture. And we are also, as I said earlier, we are always amazed by people like you who come forward and then share what God gave them with us, to be able to do this venture. So sometimes, when people go out, they are looking for donation and this. So we don't call it donation, we call it partnership. Fundraising in this cause is a partnership thing. We have the capability, we have the expertise, but what we lack is the resources. So if anybody has the resource, you bring it forward, we put the resources together with our capability, with our experts. So we put this together, we're able to help, and then this is what we stand for. And then there is nothing more noble than working for your own people, working for your own country. There is nothing more noble than that. And this is our calling. And really, this is what we task ourselves. So, this is what Amisurge is all about. Gambian health care workers coming together to go out and conduct safe surgery into the hinterland of the Gambia to make sure everybody living in the Gambia has access to safe surgery. This is our mission, and we want to expand it to the highest level. And that's we really be happy to continuously receive this type of support from people like you.
Indeed. And also, I can also tell you, it's not only the funds that are also involved. We've also made it open to make sure every Gambian, irrespective of where you come from, has your slogan. So I'm very grateful. I'm very grateful to you.
So far, since we came, we've done some couple of surgeries, and then the children's side, this is the third one, and then as young as we have as young as 2 years all on our list. So we'll operate in the evening, and then if we are not able to finish, probably we'll do some in the morning. Because most of us work in Banjul, so we have to go back and stand this out.
Thank you very much. Thank you very much. Exactly, okay.
He's a procurement manager, and then my technical I'm bringing to my logistic team so that he can help us. This is Marcel, also part of the member and this is Ami, Oli is also my aunt, also Foja.
That is my daughter. But I'm going to they eat a lot. Then food is available.
Yes.
I said I'm from
So this is what they do.
Yes.
Have you spoken to Aminata, the head of the theater?
Aminata, yes. Dr. Manneh, there is something.
So don't put one Manneh there, I don't know. We can put
Thank you so much.
Very appreciated.
Thank you.
Dr. Manneh, just brief.
I enjoy it. Now I have energy. Thank you. Because after just 6, we came straight to theater. We started by 7. Yes. We went to house.
Can you please turn off this one? It's honey, right?
Okay. It's taking us to.
Thank you very much. This is Amisurge. It's a group of surgeons, anesthetists, theater nurses, medical students, even volunteers who are non-medical. And this time, Honorable with us is also part of all these activities, so we are including him too. Our main purpose is to see how best we can help people with surgical conditions, and sometimes not only surgical conditions, mostly in the provincial parts of the country, because we work in the teaching hospital and we work in the other major hospitals in the western part of the country. And over years we realize there are patients who will be going and coming from distant parts to a point that they get tired and they stop. Only to come with complications which are life-threatening situations. If you don't operate, then they will die. And this part of the Parliament, then we put our heads together to see how best we can contribute our program. Because we have the human resources. So with people like you and other governors and district hospitals, CEOs, we realize that we can go beyond our normal working hours from 8 to 4 during our own calls. So this, a day like today, Saturday, Sunday, and Friday evening, we voluntarily contributed our materials, our monies together, and with your collaboration, we are able to do a lot of surgeries here. We've been to almost every hospital. Passe, Wise, Parafenye, Bansa, Brikama, even in the main teaching hospital, we did one like that. So this time is Bwam. And last night I promised the CEO that next year, a year from today, we will come back here again. And I want to do the same promise with you.
Okay.
Yes.
Thank you.
Thank you very much for helping us. Because we also face challenges. The challenges are accommodation, feeding, and the number is increasing. Everybody wants to put in their best. So we started with around 35 participants, 50, now 60. In fact, if we had opened it, it would be more than 60. But that's good. As our participant number is increasing, the patient number also is increasing. Yes. So we just very happy to say thank you.
Normally, face challenges. What really admired you in the Foni Kansala Constituency until you said that next year you will come back?
I'm just going for the food. They are providing breakfast, lunch, and dinner for us. And that is one of our challenges. Yes, because I'm blessed. Secondly, other places, when we go, we pay for accommodation. And that's another challenge. I was posted in a building that is just completed, fresh. So thank you very much for that. So our challenges are numerous. But of importance to patients is the material, surgical items. They are costly. This morning we even have to buy more. Last evening we bought. We contributed our money together. We bought. So this morning we are communicating with some people to buy more from Kaibah Farms. We buy from Kaibah. In fact, I had to call the man, text the man to say, what will be your contribution? Make discount for us. Yeah. So
What is your name again?
Dr. Manneh, I like it.
Dr. Manneh, it's a pleasure. I think this is enormous. And as you go out, since yesterday, I got a lot of reports, from patients, families, that the surgical camp is well done. And with your little time that you have spared for us, I think it will wipe our tears for a long queue of patients who will get access to surgery. What we do in intervention and Amisurge is something else. For us in Kansala, I can tell you, accommodations, whatever, we will handle that. And currently, I just spoke with the lodge guy. There are some people who are there, but by late in the afternoon, they'll be going. So most of new people came transfer to the lodge. So generally, we will control everything. And I think this is a great partnership. And for Amisurge, we cannot say anything. A lot of people who are here, some of them will tell you for 1 year, 2 years, we've been having a queue of surgical operations, we cannot. but just a couple of hours they were able. Yesterday night he called me and said they did 17. You know, so looking at the comments, I know today they will do more than 50. So very appreciative of you. So my contact with him just came it on the blues. You know, he met me in Parliament with his Ibrahim and the team and said, anyway, we've seen your effort that you are doing international development. We have an organization that is Amisurge. So they introduced to me. I said, why not be part of it? And this is how we came to realize and also have this surgical camp. And I think this will be history in Foni Kansala, most of Foni. I can say it's about 50,000 population within the west coast of Foni and the entire catchment area that this hospital is feeding. So looking at the congestion aspects, if for example they treat 100 patients, so you got 100 patients, how much would you reduce in Banjul, in Edward Francis Hospital, in Canifin, and other areas? So I think this is necessary and they are doing it in the right direction. And I'm very happy as a representative of the people. It has never happened at this magnitude, where in this hospital we have over even 17 surgical cases a day. So I know they have about 100 and something. I know we'll be able to. We'll exhaust the list. And I can also tell you, at night, we'll also do barbecue today also.
Yes, thank you. We entertain our volunteers in charge. This one is Saturday evenings when we finish celebrating the spare time and we also socialize.
Our Vice President Abdulhamid
Thank you for 1 or 2 words.
Oh, okay.
Good morning, everyone. Welcome to Bwam General Hospital. I'm the Vice President of Amisurge. Abdulhamid Kante. Yes, he is our head of administration. Amisurge is a charitable foundation. That was started a couple of years ago. The idea was to complement the efforts of the government in terms of taking care of patients. We realized that in our main hospitals we usually have a backlog of patients waiting on the surgical treatment. So that is the main reason why we set this group up, to be able to reduce the number of patients that are waiting on the surgical list. So far, I think this is the 8th surgical camp that we've organized since the inception of the foundation. And alhamdulillah, everything is going smoothly. Of course, without challenges, we have our own challenges too. And along the line, we've been learning through the process and we've been having very successful surgeries. The last one we had was in Bansan. I can't remember the exact number, but it was a huge number, and the people were very appreciative of our services. And we want to say a very big thank you to our host here in Bwam and the National Assembly member for accepting us as a community and giving us the help to be able to do their services.
You said that you normally face encounter problem. So what's the difference between this constituency, that's Foni Kansala Constituency, the experience that you got here and where you have been?
Okay, I think this is the second time we're coming here, if I can remember very well. The problems we've been encountering so far is one in terms of materials, consumables. They are very expensive. Surgery is not very cheap. In fact, medical service is not cheap. So we find it difficult to get most of our consumables because they are expensive, ranging from drugs and other consumables. But we've been trying to make sure we do what we can do and try to help the people that need the services.
And then you said that you are the vice president of
Amisurge.
When did you start it? And then the duration you started, and then now, which changes do you have, and then which challenges are you facing?
The challenges, like I said, most of the time it has to do with the medications and the consumables. The surgical items are expensive. Especially like sutures, when it comes to sutures, anesthetic drugs, other consumables too. But we've been having issues, but sometimes when we go to places, the hosting hospital will also provide some material, even though not enough, but we try to use that and then go ahead with our procedures.
Okay, apart from that, the problem that you encounter, do you have any other problems that you encounter concerning about the patients?
Concerning that?
About the patients?
About the patients.
Yeah, the problem is usually where we are going to, patient preparation sometimes becomes a problem, especially if it has to do with major cases that will require blood transfusion. Sometimes those are challenges that we face.
Thank you so much, we are very happy for giving us the time. Thank you so much.
Okay, and this one, head of anesthesia.
My son is thank you very much. We're here in Bwam. First of all, I think we have to extend our the Honorable who has been very steadfast and along the line he was very active to make sure that at least this humanitarian activity has gone. I think this is what we expect. Leaders, especially community leaders. We're here in Bwam once more. This is not the first time we have been going out under the name of Amisurge. Surgical Foundation. It's a humanitarian surgical foundation. We don't have money to give out to people, but we have brain skills to give out to our own people. It's very pathetic. You are over there, you see patients coming from the provinces with things that can be done in their community. So this is one of the main objectives why this is set up to continue help Ghanaian with the little that we have and with the support of other individuals and community members in various areas. So as usual, we have been going to different places. We have done tremendous work. And one of the most impressive, we never got any problem. So I think prayers are always with us. This is tremendous. We consider the number of things that we have done. On the area of anesthesia, that's my specialty. Because the group is diverse. We have a diverse group. We have surgeons, we have anesthetists, we have perioperative, different area of operation. So together we form a team. Because operation, one person cannot do that. The team do an operation. So we thank God that the team has bind together. They're working very hard to make sure that we one of the main challenges that we have, and Dr. Teo, I was thinking about it, we have challenges of resources because we don't have an established finance where we have. We don't have a permanent sponsor. We keep begging to help people. So I think, but we thank God. Anytime that we come out, we have few with their heart. They love to the people that they serve. And this is for something. And individually, we also contribute. We don't only come and walk. We make a pledge. We open a page in our own page. Open pledge. So we give 1,000, some 5,000, some 3, some 100, some 2, but no amount is small. Because we feel we're doing it for our own people, so we thank our own. So in a nutshell, we are here in Bwam today, and we go before we go at the end of the day. We want to do all the cases. All the cases. But we don't want to do anything that is complicated. We don't want to leave any problem into our people. Like we don't want to do any operation whereby at the end of the day that patient is going to suffer. That's not it. So along the line, we may postpone some cases. Cases that are assessed, because we usually assess, as long as we want to do so many cases, we want to do all of them. We have about safety. We always consider safety as number one. We will look at you, assess you, if you are fit to be operated, and then you are fit to stay when we leave, then we are operated. Because we have different area of specialty. I want to show them as well. So our other team members, urologists, are also coming, which is another added advantage. Because we have some cases of urology that will also be done. So that's a big
And Mr. So before we proceed, do you have any sponsors from any institution in the Gambia or on the government?
No, usually, as we said, when we go on any camp, we make an open. We bake. Big ministry, we big individuals, we big ourselves. So along the line, it's not permanent. But we have some positive response from individuals, but we don't have any permanent sponsor.
Okay.
Okay, thank you so much. With all those challenges that you face, you come to this Foni Kansala Constituency, then you happen to say that Honorable Almameh Gibba have given an assessment based on the feeding and everything. What message do you have?
Sorry, I don't get it.
Can you speak loud?
Okay. I said among all the places that you call, you said feeding is always a problem to you guys. And you here in Foni Kansala Constituency, feeding is not a problem, as you said. So what message are you going to deliver to Honorable Almameh Gibba?
We just have to say thank you once more, because all along we have been interpreting. He was very instrumental. I said, my this Joram and his very argument is going on. So hopefully, and he's here again. So we just to say thank you very much. And we hope this is going to continue. We will come back. The man is head of Amisurge is here. We will come back, inshallah.
And since we are in Foni Kansala, I'm going to tell Honorable, thank you very much. Abaraka, Emite Kati, Jaja.
So our host will talk as
Tell us your name.
My name is Almameh. I work here at Bwam General Hospital as a perioperative nurse and as well as clinical service operations supervisor at the duty room. Yes.
What message do you have?
What message?
What message are you going to deliver based on this surgery?
The message on behalf of the hospital is we are so much grateful, we are so much appreciative of Amisurge for taking this initiative within Bwam General Hospital, and in particular Foni Kansala. If you will, it will interest you to know, we have a very large catchment area of about 60,000, where the catchment area alone is not where our patients are coming from. So you have patients coming from all over the country, even the neighboring country coming to seek healthcare services. So having this initiative here, the importance cannot be overemphasized. Imagine, these are surgeries that cost a lot of money. These are surgeries that takes a lot of time. These are surgeries that require specialist management. So we have all these different specialists here coming to render these services at no cost to the patients. That is tremendous. That is tremendous. Now, on behalf of the hospital as well, I would like to thank Honorable Almameh Gibba, the National Assembly member for Foni Kansala. He has been tremendous. He has been on the forefront, making sure this event becomes a success. And also our Chief Executive Officer, which is Mr. Manneh, very proactive, and he's a leader by definition in all aspects. So I want to thank the Amisurge, I want to thank the hospital, I want to thank the National Assembly member and all the patients for making this a success. Yeah, we hope this will not be the last time.
And then I have a question for you.
Yeah.
When these people started operation, I heard several years back, so many Gambians will go outside to find in for surgery or operation, and then now we have the Gambian people which are doing this operation. How do you feel about it?
Like I said before, I feel very grateful and I feel very happy that we have our own people coming to serve our own people. It's like me serving myself. You know, the gratefulness cannot be overemphasized. Imagine the cost is going to cost for one patient to get these services from abroad or from overseas or the neighboring countries. It's going to be a lot of money. Healthcare cost alone can cause some families to go into household impoverishment. So these are initiatives that help in reducing the direct